This training is going to dive into what a Medicare 101 is and some of the different ways that we can actually use it as agents. So before we get into the slides, I just want to touch on that piece. One way that you can use this Medicare 101 presentation is if you are a newer agent, or even if you're a seasoned agent, you have a client who is uneasy, they're pushing back on things that you're trying to explain to them. It can be very, very useful to pull these slides out and walk them through a concrete basic Medicare 101. Again, even if you're a seasoned and veteran agent, I also think this is a really good piece to go over with a client in a one-on-one meeting, 16 to 11 months or so before they turn 65. So any of you that are agency attached, where we're always talking to you about your opportunity to work with your book of business and to be able to, in turn, reach out to those people as they approach their 65th birthday. If they're coming in way, way, way early, like I said, 12 or 11 to 16 months before they turn 65, going through this presentation can be incredibly helpful to them. And if you're the one who's teaching them these basics, the likelihood of them coming back to you for the enrollment is considerably high. The other application where we tend to use these presentations might be for live events and seminars. Maybe you've been invited to talk to a Rotary group or a retiree group at an employer or a group at your local library or YMCA. The Medicare 101 is an easy presentation that you can do to teach people Medicare basics. I do want to put this caveat out there. Please, if you are active in grassroots marketing, you're out promoting your agency, doing presentations for the public, do not fall victim to the Medicare 101 only trap. I know a lot of agents who the only presentation they ever do is a Medicare 101. That's okay, but think about this. Everybody can do a Medicare 101. It doesn't really make us that unique in the industry. It's a tool that we have to have, and we have to be willing and able to do these presentations. However, what other things can we talk about that maybe differentiate ourselves from everybody else in the industry? I do a series for churches where I go in and talk about some Medicare basics, maybe 10, 15 minutes. And I talk about retirement in general and finding your worth in your retired years. Because I know from meeting with thousands of people that that is a legitimate concern. What will my identity be in retirement? So I get to go ahead and get in front of those people and talk about Medicare basics, but then also dive into helping them identify how they can find worth. And then I wrap that session up with some live worship music that I lead. That's very unique to me, and I'm sharing that in this presentation to hopefully motivate you to think about presentations that you can do that separate you from everybody else who wants to serve the senior population. Maybe you were a former massotherapist or physical therapist. I know two of those people that work in the Medicare space. What can you pull from your very rich background in the healthcare industry to create unique presentations for your members? Maybe you speak multiple languages and you want to talk about language barriers in the Medicare system. That is a very unique topic that you could do. That is, again, a differentiator. So I don't want to belabor the point. The whole point, though, is don't only live and die by the Medicare 101. A valuable tool, but we don't want this to be the only tool in your toolbox by any way, shape, or form. So what I'm going to do is walk you through this presentation. We have several of these, but this is the one that TLC has available to you. It can be customized for you. We're just going to walk through it as we would in a live presentation, either with a client in my office or in front of a group, small or large. As we go through this, I will try to go ahead and give you some tips and pointers on what you might be able to do if, in fact, you are the presenter. So I'll go a little beyond the routine and get more into some of the specifics on each slide that you might expound upon if you're doing this presentation. So the first slide that you see here, what is Medicare? As we all know, a federal health insurance program for eligible U.S. citizens and legal residents. It is individual health insurance. I do like to enumerate on this. That is a confusion point for retirees, for seniors, because they're not used to that. Very many of them previously have had plans through a spouse or they themselves that included their entire family. It even included their children until those children reached age 26. So this is new. This is nuanced, right? Individual health insurance means that if I have a spouse, my spouse and I are both turning 65, we could in fact have different plans because Medicare does not make plans that are beyond the individual level. It is funded in part by the taxes that you pay while working. So who's eligible? You must be age 65 or older, and you or your spouse worked and paid Social Security taxes for at least 40 quarters, which is 10 years, right? 4 quarters per year times 10 equals 40 quarters. So that's one way you can be eligible. Or you can be any age with a qualifying disability. And we're not going to get into this in the presentation, but in your advisement, typically if someone is under disability for 24 months, they qualify for Medicare. And that's for a long list of disabilities. Or any age individual with a diagnosis of end-stage renal disease or ALS. So these are general qualifications for eligibility, and contrary to what you might read online or see in social media or even our national level media, you must be a U.S. citizen and legal resident. So legal residents must have lived in the U.S. for 5 consecutive years, including the 5 years immediately preceding their application for Medicare. Preceding their application for Medicare. So you can't just move to our country and immediately go sign up and be enrolled into Medicare. Has to be 5 consecutive years. Very, very important thing for us to know, very important thing for us to teach, especially at this point in our history where we do have a lot of individuals that have newly come into our country. Some are legal, some are not, and we need to be able to distinguish that and make sure we understand the Medicare rules as agents. How do you apply for Medicare? So you know you're going to be eligible. How do we get your application submitted to get these 2 core pieces, Part A and Part B, which are known as Original Medicare? If you are receiving Social Security, I'll say that again. If you are receiving Social Security or Railroad Retirement Board benefits at least 4 months prior to being eligible for Medicare, or after receiving Social Security disability benefits for 24 months, you will automatically be enrolled in Original Medicare Part A and Part B. Now, there's that point that we mentioned earlier that if you are receiving disability benefits for 24 months, automatic enrollment into Medicare Part A and Part B. This first paragraph is really important because you're going to meet with people who maybe do not want to get Medicare Part B yet. Maybe they're turning 65, but they're going to continue to work. They have a good job. They like working. They're not ready to fully retire, but they're already getting Social Security monthly benefits on that financial side. Used to be checks, right? Now it's direct deposits. They're going to automatically be signed up for Part A and Part B upon turning 65 if they were getting that Social Security benefit 4 months before their 65th birth month. When they get that packet in the mail, there will be information on what they need to do. It's a form they complete and send back, and they can say that I'll take Part A, but I want to defer Part B. There's a whole nother set of implications there that in your advisement you should be aware of. We're not going to get into them in the Medicare 101, but if you don't know about how health savings accounts work and the timelines associated with health savings accounts when it comes to initial enrollment and premiums and contributions, make sure to look that up. Just go to Medicare.gov and read about health savings accounts. So if that individual is in fact delaying collecting those retirement benefits, they must actively apply. So if I'm not getting my Social Security checks 4 months before, or Railroad Retire Board benefits 4 months before, I haven't been on disability for 24 months, me getting Part A and Part B is an active application. And that's for either of these, Railroad or Social Security. So during that 7 month initial enrollment period, IEP, 3 months before my 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday, you as an individual can go online and apply at ssa.gov/benefits/Medicare. You can also contact your local Social Security office. There's actually also a hotline, an 800 number that they can contact, that they can find easily online. So depending on where you're at in your process of agent training and comfort and experience, you may offer, if I'm doing this 101 training in my office with a couple, maybe not in a large group, and they need an active application in order to get Part A and Part B. If I know how to do it, I've been trained on it, that might be something that I assist them with. I can say, well, I can help you make that application when the time is right and save you a trip down to the Social Security office. Make sure you know what you're doing, though, if you get into that type of supportive assistance. If your client is talking to you about Medicare to get a good idea about what choices they should make, but they intend to continue to work beyond age 65, there are some Medicare coordination basics that we go over in this 101. So with group health coverage, if your employer has 20 or more employees, the group plan of that employer will pay first, and Medicare will become the secondary payer. If that employer has under 20 employees, Medicare pays first, and the group plan is secondary. And so when you take a look at that, it's a pretty important piece of information for an individual to have. Knowing that little detail right there might help an individual decide whether or not they want to get Medicare or not. We need to be really mindful of explaining that to people who intend to work beyond age 65. Because if my employer has 20 or more employees and the group plan is going to pay first, I have to look at how good is my group plan, and do I truly want to take on a Medicare Part B premium at that point in time? I might not want to. The same is true with under 20 employees. If I know that Medicare is going to pay first, do I really want to take on a Medicare premium and then have that employer provided group plan pay secondly? Is the cost and premium worth the coverage is always a question that we end up taking a look at. COBRA and retiree plans are another important piece that we go over in the presentation. COBRA does not delay the need for Part B. COBRA does not meet the federal guidelines for credible coverage. And so we want to make sure that we don't tell anybody, once you turn 65, just stay on COBRA, because they're going to start to accrue a late enrollment penalty should they do that. They have to apply for Part B. They cannot stay on COBRA past age 65. How do we avoid late enrollment penalties? We just said it for Part B. You want to enroll when you lose active group coverage. We can help them do that prior to their employer plan going out of act. We can do that prior to their employer plan going inactive. That's what I was trying to say. So we can help them with that, right? Come back to us 2 or 3 months before you're ready to leave employer coverage, and we'll help you with this process, preferably 3 or 4 months. Same with Part D. We want to be enrolled at that point in time when we lose active group coverage. And we want to ensure that we've had credible drug coverage once we're on Medicare Part A and Part B, or we can face that penalty of 63 or more days. If I'm on Medicare A and B and I go any period of time of 63 or more days, I'm going to get a late enrollment penalty for Part D. So importantly here, when do you enroll? So if you're going to delay Part B, only if you're covered by an active employer plan, again, not COBRA or a retiree plan, and we're going to enroll in Medicare within 8 months of losing active group coverage. If they're working closely with us, we're going to do that prior to them losing that coverage to make sure they have no coverage gaps. There's a lot on this slide. You could probably talk about this one slide for 10 or 15 minutes. So it can eat up a lot of your presentation. This would be an example of a slide that you might be interested in breaking down into a smaller presentation and doing this at that library or at that YMCA. Maybe you only go over eligibility, how to apply, and working beyond 65. I truly believe as agents, you could stretch this into a 15 to 20-minute presentation, just the slides we've just gone over. So here's the nuts and bolts that we all know very well: Medicare Part A, hospital insurance. You're all agents. You know these details. I'm not going to go over this with you on our webinar right now, but I do want to point out two very important things about this Medicare Part A information. One is make sure to explain, whenever you're talking about Part A, what a benefit period is. A 60-day benefit period is very strange until you hear about it, and then it's still strange. So it's a 60-day benefit period, which means my deductible on Part A is not an annual deductible. I'll say that again. My Part A deductible is not annual. It's per benefit period, which is every 60 days. That is really different, folks. Like, think about it. Any other point in your life, have you ever had a deductible that's not 1 year? It's so we're so conditioned to think of deductibles in terms of a year that this is bizarre, and we need to make sure we explain it really well. A point that I see when I go out and watch people do these presentations that gets missed or not touched on nearly strong enough, in my opinion, is the last sentence in the box to the right that says there's no out-of-pocket maximum limit. We want to enunciate that when we do these presentations and whenever we talk about Part A and Part B. Because we all come into this typically from employer coverage where we have all had, almost for the entirety of our insured lives, an annual out-of-pocket maximum limit. We need to stress that point, especially with people who are reluctant to get coverage beyond Medicare Part A and Medicare Part B. I just did a webinar on a pending potential rule change regarding Medicare, and it prompted me to look up how many people are only on original Medicare right now in the US. And the data that was available was from 2023. And it said 3.8 million people were only on original Medicare Part A and Part B. So 3.8 million insureds, Medicare insureds, not really grasping or caring about the fact that when you look at this list of copays, they have no limit to their potential risk and expense. I was blown away by that number. And if that was in 2023, I can only imagine it's probably higher now. I would certainly hope not, but typically those numbers don't go down. Again, Part B, we know this well as agents. We're going to explain what's on the slide in our presentation. I would enunciate the fact here that the deductible is now annual. So Part A, 60-day benefit period. Part B, annual deductible. And in this case, it's $283 per year. I would also make sure we don't typically get into a lot of IRMA conversations when we do these presentations, especially in this format. But when you're meeting with a client, make sure to explain what their income-related monthly adjustment amount might be and how that affects both their Part D and Part B cost and premiums. So it is on the slide, right? You see the second bullet point, premiums are adjusted based on household income. We want to make sure that we hit that pretty hard and don't skip that bullet point. The 20% is huge. The 20% sounds great. You're going to have some people that are hearing this presentation who've been on a 70-30 plan, or they've had a 60-40 plan, which is rare, but 20% can sound good to someone who thinks about that initially, that 80-20, the government's going to pay 80%. I only have a $283 deductible. That's going to sound really good for people that have a $7,000 or $10,000 deductible coming off of that employer plan. But the key words again on the slide are at the bottom. There is no out-of-pocket maximum limit. When we take a look at that, that should be paramount. If I get placed on a Part B medication, chemotherapy, radiation, dialysis, many of the new immunotherapy treatments, and I'm stuck paying 20% of the cost, that could be life-altering and true financial crisis for that individual. The 20% matters a lot in helping people understand that 3.8 million people understand why they need the additional coverage that we can help them with as an agent. Medicare Part D prescription drug coverage. Again, just walking through the bullet points on the slide here. There's coverage for prescription drugs and certain vaccines not covered by Part B. There are two ways to get coverage. They can get a standalone prescription drug plan, as you know, Medicare Advantage prescription drug plans, as you know. Sometimes I mess up on this myself in doing trainings or conversations with individuals. When you say Medicare Advantage, try to include Medicare Advantage prescription drug plan. That's a good thing for you to do if you're a newer agent, because you can easily, I've seen it happen multiple times actually. If you inadvertently enroll someone in a Medicare Advantage only plan that does not have prescription drug coverage, they have a problem potentially if there's no enrollment period to make a plan change. So there are Medicare Advantage only plans, which assume that that individual is getting their medication somewhere else, like the VA. A lot of veterans will go on those MA only plans. So say Medicare Advantage prescription drug plan, MAPD, as often as you can, to just put that into your subconscious that there is a difference between a Medicare Advantage plan with and without prescription drug coverage. We touch on the formularies. There's a tiered formulary. Drugs are grouped into tiers based on cost. In general, the lower the tier number, the lower the cost, and deductibles can change and be charged by tier depending on the plan and the carrier. Prescription drug costs depend on the formulary tiers of medications and the coverage stages entered throughout the year. Costs are subject to change annually. Last bold sentence I would maybe talk a little bit about here. This is why you want to meet with me as an agent. You can go sign up for a drug plan, but you're not going to stay educated on Medicare. You're not going to do the training and go through all the different annual upkeep and certification that I have to do as an agent. I'm going to know what's changing in the Medicare space, which is going to help me advise you on how cost and tiers and formularies and networks are going to change each and every year through your retirement. A lot of times Medicare, for me, being an educator by trade, it feels very much like education. It's teaching, it's coaching, it's explaining, it's answering questions and mentoring. But when we're doing this presentation, especially in front of a group, we may need to put a little more effort into being salespeople. And what we're selling is us. So take moments like this where you can encapsulate your value and give that whole audience the desire to come meet with you so you can be the one that takes care of them. We have a couple slides in here on the Medicare Part D prescription drug stages. You can see them here. You all know them well by now. I'm not going to read through this. We literally touch on this and explain what each stage is. It's much simpler now than it used to be, where we had the donut hole to explain. The key words, though, that you want to keep in mind, and you want to always stress this when you're talking about anything regarding Medicare insurance for that matter, is covered drugs. If you say $2,100, right? You meet $2,100 in your prescription cost, and now you're done paying. That's technically not correct, because there may be medications that are not covered by that plan. So that's where in the catastrophic coverage stage, you see $0 for covered drugs on the plan formulary. We need to condition ourselves to say that every time we're talking about coverage, right? When you talk about Medicare Part B, say services covered by Medicare. And just build that language into your presentation so that no one ever takes what you say and interprets that to mean, hey, every medication that I get, it doesn't matter if I hit $2,100, it's good to go. Because there's a lot of medications that are not covered by Medicare at all. No plans have to cover them, especially things that are elective in nature. And here's a little slide differentiating from 2025 to 2026. Not very impactful, just shows an increase in the maximum deductible amount in that first column there from 590 up to 615. And then the second box shows the increase in the max out of pocket of 2,000 to 2,100. We already touched on this, but it's a good point again to remind individuals at this point in time that they do have the initial enrollment period where they can sign up. It's a nice visual slide. It gives you the ability to talk about this. And what I like to do on this slide is clearly say and clearly state, you need to make sure that we connect in that 3 months before you turn 65. Ideally, I'd love to get you on my calendar for that 3 months out. That way we have ample time to help you answer any questions about how you interact with Social Security to get Part A and Part B. And if we have to wait for you to get your card, we have enough time in that window to do so. Would love for your benefits to start the first of your birth month. Just stating that is a pretty good call to action, and it gives the people listening to you the desire to maybe take that next step. There is a little note here that we put at the bottom on that simple fact that if you were born on the first of a month, your benefits do get to start a month early. And you're going to want to know that and share that. It just shows that you're a well-informed and knowledgeable agent. We then slide into some additional enrollment periods here. Again, you know these well from AHIP. I'm not going to go over these verbatim today, but we touch on these different enrollment periods. What I would do if I were you, it's not on the slide, is again encapsulate why you can help people and why they should see you as an agent. Come see me during the enrollment period every year, annual enrollment period every year, so that I can help make sure that if your coverage is changing, we know what that looks like, and we can make the best decision as to whether you should stay with that plan or not. Say that when you do the presentation. The MA open enrollment period, I don't stress that one as much. That's much more consumer protection facing, but it is worth saying that if you have a loved one or family member who maybe got placed in a plan that wasn't right for them, we have the ability to help them in that period from January 1 through March 31. The SCP, I might call back here and say, as we talked about previously in our presentation today, if you plan to work past age 65, we're going to have the opportunity to help you when the time is right. Whenever you decide to leave that employer plan, reach out to me and we will take care of you. You can say too, the same is true if you ever move. All you have to do is reach out and we'll help you take a look at your service area and make sure that the coverage that you have doesn't need to be changed. And if it does, we'll again help you find the right solution for your needs. So I go over the details here in the presentation, but I really try to use each of these to say why I matter as an agent. These next two slides are vitally important. It's a nice segue to say, when we went over the Part A and Part B cost, we mentioned multiple times that there's no out-of-pocket limit and that it leaves you fairly vulnerable to massive bills and massive cost if you have major medical needs, either by way of multiple hospitalizations and or Part B medications or a lot of medical services on the Part B side. And we have two pathways to help make sure that you're protected. That's what insurance is, right? It's just indemnification against risk. Pathway number one is we can help you find a Medicare supplement plan that meets your needs. That plan will pay for some of the out-of-pocket costs that come with original Medicare. We're going to pair that plan with a standalone prescription drug plan, and that plan will help cover the cost associated with Part D medications and certain vaccines. And then we're going to round out your coverage with an individual dental and or vision plan. And so this coverage model is going to give you some things that we're going to talk about in a moment. This is one of the pathways that you can take to ensure that you are well covered through your retirement years. Pathway option 2 would be what's called a Medicare Advantage plan. It's also sometimes referred to as Medicare Part C. And these are going to be very similar in a lot of ways to the employer plan that you might have right now. A Medicare Advantage plan is a Medicare approved plan offered by a private insurance company, and they're going to bundle all of your care and services for Part A and B together. Many of them are going to include Part D coverage, and some of them will offer extra benefits that original Medicare doesn't, like included vision and dental services. So when you come to our appointment in person, our goal is to help you navigate these two choices and really figure out which one might be right for you. And then we have some nice bullet points here that you can talk about. So with a Medicare supplement plan pathway, that was option 1, you're going to pay now for lower costs later. So think higher monthly premium, but very, very controlled cost if you actually need to access care. You're going to have monthly premiums, lower out-of-pocket expenses, and your plan will pay for all or most medical deductibles, co-insurance, and co-payments. You can typically use any doctor or hospital that accepts Medicare. Why? Your network is non-existent. Medicare supplement plans are not technically health insurance. Your health insurer is the federal Medicare program, Part A and Part B. The supplement plan is just helping to pay some, or with certain plans, most of your share of the cost that we went over earlier regarding Part A and Part B. Now, with the supplement plan, it doesn't include standalone drug coverage, so we have to, let me say that again. With your supplement plan, there is no included prescription drug coverage, so we have to add a standalone plan to help you with that, along with other plans to help cover things like dental, vision, and maybe hearing aids. Medicare Advantage plans are almost the opposite. It's with a private insurance company. You're going to pay as you go, so low monthly premium. And then after that, you're going to have deductibles, co-insurance, and co-pays for services, just like you probably have now on your current plan. You will, though, have a network of healthcare providers, including doctors, hospital, and facilities. Many of these plans will include prescription drug coverage, and some plans cover ancillary benefits like dental, vision, and hearing. One really great thing that we can sometimes help you with, and many of our clients do, if you go with a Medicare Advantage plan to help reduce some of the out-of-pocket risk, we have some indemnity plans that can also be placed alongside that to make sure that you don't have high hospital bills. The key thing you need to understand, folks, about both of these options is they limit your risk. That whole Part A and B presentation that we did a little bit ago, remember we said Part A and Part B, there is no limit to how much you can spend out of pocket. Both of these options will help you do so by capping that risk. And we'll go over those specifics when you come in for your one-on-one meeting. If you are working in an agency and you have home, auto, and life insurance, a good way to look at this is it is kind of philosophical. If I like Medicare supplement plans, I'm probably the same client that you have in your book of business who likes high premium, low deductible home and auto insurance. I probably also carry quite a bit of life insurance because I see a value in paying to have coverage for security, if that makes sense. If I'm in your book of business, I have no life insurance. I want the lowest premium, highest deductible insurance. I'm probably more of a Medicare Advantage person in terms of philosophy. So if you already have these individuals on those products in your book, you kind of have a leg up on where their mindset might be when you go over these things. The goal, folks, is not to give them everything in this presentation. It's to leave quite a bit of ambiguity there and to keep saying throughout the presentation, when we meet in person, or when we meet in your individual appointment, or when we meet in your personalized consultation. That's what we want. We don't want to give away everything and teach them every single thing about Medicare in this Medicare 101. So we get into some of the things that original Medicare does not cover: prescription drugs, Part D. Make sure we say prescription drugs because there are Part B covered medications. Dental, vision, and hearing aids. Again, there's a little nuance. There are some medical vision type things, medical dental type things that Medicare does cover, like cataracts, for example. So we want to say routine dental, routine vision, perhaps, emergency coverage while traveling outside the US, and other benefits and services that might be available to those who qualify financially or medically, such as meal delivery, transportation, utility assistance, and over the counter. So we wrap this presentation up with a little bit of a PSA of sorts. We started to do this a few years back, just touching on some of the scams and what to look for. And I believe if you go over these, it helps you as an agent because you're planting in their mind the truth that they're going to be basically solicited nonstop. And so that's what I would say here. Very recently we added a scam slide to our Medicare 101 presentation because we want you to know what to be on the lookout for. There are some very aggressive and threatening tactics where people will call you over the phone, unsolicited, by the way, and then they'll try to pressure you into making a plan choice. As we went over here today, the timelines are pretty clear. You see what's expected of you from the government in terms of enrollment so that you do not get penalties. By no means should you let somebody threaten you or scare you into making a choice over the phone. And why not work with us in person so that we can have that ongoing relationship and we'll take care of everything that you need us to do. Identity verification, we strongly recommend that you don't give your personal identifiable information out over the phone to somebody that you don't know. And by the way, Medicare, the federal entity, is not going to call you unless you have a previously scheduled appointment to talk to them over the phone. Typically that phone appointment is detailed in a letter even before you have it. So when someone calls you cold and tells you they're from Medicare, they are very likely a scammer. The same is true for email solicitation. The federal Medicare program, people that work there are not going to be reaching out to you over email asking you to make plan decisions. And as you all already know, you're going to get pile after pile after pile of mail. Most of it is a solicitation. What I like to tell my clients to do: throw it all in a bag, bring it to our personalized consultation, and we'll go through your mail together to make sure that we're sorting out the junk from anything that you might actually need. Some tips at the bottom here about what to do if you suspect fraud or if you're being intimidated and threatened by people through marketing attempts. And then lastly, a little personalized slide for you, your agent information. Let me help you eliminate the confusion surrounding Medicare. Here's some of the services that we provide, and thank you very much. So that is our basic Medicare 101 presentation. And I know we kind of jumped through it pretty quick, but you know the content pretty well. Even if you're a newer agent, you're going to know most of this content from your licensure course, your AHIP, your carrier certifications, and then a lot of the trainings like this that we have put together for you. The goal of our presentation today was to walk you through the template and to give you some of those additional talking points that you're going to need in order to provide a good presentation for members. A couple of tips if you do a Medicare 101. Number one, make sure you're comfortable with the audience. Don't just agree to do a presentation anywhere and everywhere. Understand the people that you're going to be talking to, who they are, how they may behave, and if you're comfortable with that or not. I'm not going to go list different environments that we could do presentations in, but I would tell you that there's some agents that I work with who are not equipped to go talk to certain groups at certain locations. And that could be maybe a higher income or lower income setting, depending on who you are and your degree of confidence. And we could go through a couple of different scenarios thinking through that. Maybe it is a retiree event and there's going to be 60 people there and you're afraid of getting up in front of groups of that size, but you would be okay talking to 8 or 9 or 10 people. Maybe it's at a VFW with a lot of veterans and you're not really up to speed on how veteran care and Medicare kind of work together. You probably shouldn't go into that until you are. So you have to be discerning about yourself as a presenter and are you comfortable to do that presentation? Because as good as as good as a presentation done well is for your business, think about the impacts if you do a presentation poorly. It creates doubt in the minds of the people that you're talking to about your ability to help them as an agent. I've seen it in person. I've walked around the room when people are doing these presentations, and I've personally seen the little notes that these seniors are writing down about the presenter. So you want to be confident both in your presentation and you want to be confident in the environment that you're placing yourself into to do so. Tip number 2, always say at the beginning of the presentation that in the interest of everyone that's come out today or tonight, we're going to hold on questions until I'm finished getting through the slides here. And so I've provided you a copy of the slides with some paper to take notes. Go ahead and write down any questions that you have, and I will answer those individually if we have time after the presentation, or, and again, here's another callback, in that individual meeting that you can schedule to have with me. That simple disclaimer at the front and the top of the presentation can save you a world of aggravation when you're walking through this Medicare 101. If you start letting people lob questions at you, you'll never get done. You will get sidetracked. You'll get called out on a question live that you don't know the answer to. And you might just have that one person in the audience who just loves to riddle people with questions, and they'll never let you get off of a slide. So always hold the questions till the end. If someone interrupts you with a question, say, you know what, I'm going to write that down real quick and I'll address that at the end of the presentation. And then we're going to get back to talking through these slides. That is an acknowledgement that you heard them, but you're redirecting back to the presentation. I always like to say that. Let me write that down real quick, and then we're going to continue. Or if I have somebody there, I'll say, hey, Kayla, can you write that question down so we can answer that after the presentation? If you just keep saying, okay, we'll talk afterwards, you're not really acknowledging their question as being as important as you are when you either write it down yourself or preferably have someone there helping you write that question down for you. Getting good at delivering this presentation can mean a world of difference for your business because it gives you the opportunity to talk in front of big groups. You just want to make sure you have the fluency and the confidence in order to do it well. Try not to rabbit trail too much from what's on the slides, at least your first few times doing it. And as always, if you have questions or need help, reach out to your immediate upline manager or any of us here at TLC Insurance Group. That's going to be the end of this webinar. If you like the template and you don't have it, you can request a customized version for you by email to marketing@tlcinsurancegroup.com. Simply tell the team that you watched the webinar training on the Medicare 101 presentation and you would like to get the template customized. It might speed things up if you provide the information that they're going to need on that final slide. I'm going to bring that up again so you can see it here. A nice high quality picture of yourself, your phone number, your email address, and your website, providing that you have those pieces. If you don't have a website, just a phone number and an email. I would highly advise that if you send us a picture, you make sure it's a good one, something that's really clear. If you don't have a professional photo, have someone take one for you on your phone. Most phones now have cameras that rival very expensive lenses that used to cost hundreds of thousands, or not hundreds of thousands, but thousands of dollars. That'll conclude this session. Thanks for checking it out, and visit our YouTube channel for many, many more trainings that we have done and will be doing here in the future.